diabetic patients, whether they are type 1 or type 2, are always in a constant doubt. And the question is, can I eat fruits? Hi everybody, I'm Kaveri and here is the answer to this question. Now, diabetes is broadly classified into type 1 diabetic mellitus and type 2 diabetic mellitus. Type 1 is when the person's body is not producing enough levels of insulin. Insulin is a hormone which is required to reduce a person's glucose levels in the body. It reduces the person's blood sugar levels. Now, when the person's body is not producing enough levels of insulin, his blood level of sugar does not come down and therefore he remains in a state of hyperglycemia. On the other hand, type 2 diabetic mellitus is when the body is producing enough insulin or below low levels of insulin, but here the problem is not with insulin, the problem is with how the body is responding to insulin. The person becomes resistant to insulin so that his blood levels are increasing. In both the cases, the blood level is high and so the blood level of sugar is high and so the person becomes diabetic. American Diabetes Association, that is ADA, confirms that a person with diabetes can consume a fruit as long as he or she is not allergic to that fruit. Also, according to a meta-analysis published in one of the leading British medical journals, it says that the higher is the person's consumption of fruits, the lower are his risks of developing type 2 diabetes mellitus. What is more important is the form of fruit that a person consumes. A person consuming fresh and frozen fruits are at lower risks of developing diabetes, or he or she is at lower risks of increasing their blood sugar levels than a person who consumes a lot of canned fruits, tinned fruits, dry fruits. All these are processed fruits and so they can increase the person's blood sugar levels very rapidly. Jams, squashes, fruit smoothies also increase the person's blood glucose levels very rapidly. When these fruits are processed, the fruits ultimately become low in nutrients, fiber and vitamins, adding to their ability to increase a person's diabetic condition. A person can always select food and fruits according to the glycemic index of them. Now, what is glycemic index? Glycemic index is a rating from 1 to 100. It tells us how rapidly a food can increase the blood glucose level in the person's body. Fruits with low glycemic index are absorbed slower compared to fruits with high glycemic index. One more grading is called as a glycemic load. Glycemic load takes into account the glycemic index of the food along with the number of carbohydrates per serving. Foods which are low in glycemic index and glycemic load are always helpful in controlling the blood sugar levels in diabetic people. When a carbohydrate-rich food, let's take the example of rice, is cooked for a longer time, it ultimately decreases the GI of that food. When the food is cooked for longer time and is rich in carbohydrate, other things like fat gets added up to the resistant starch in them and thus decreases the glycemic index of that food. So it is always wise for a diabetic person to choose fruits and vegetables which are low in GI and GL rather than hogging on foods which are high in GI like starchy vegetables like potato and so many other grains. Now, coming to what are the fruits that actually these diabetic people can eat, they are the fruits with low GI or GL level. With low GI level, I mean the GI less than 55. They are fruits like apples, avocados, bananas, oranges and berries, strawberries, etc. And fruits with medium GI that is the GI between 56 and 69. They are fruits like papaya, pineapple and figs. Now when a person is having low GI food, they should obviously decrease the amount of fruits because they are diabetic, but they can consume these fruits in lower quantities. Now coming to medium GI food, the consumption or the quantity of consumption of these fruits should be even more lesser than the consumption of low GI fruits. Now coming to the benefits of fruits in people with diabetic mellitus, fruits are laden with fiber, and fiber is an important component in managing your diabetes. Fiber always slows down the absorption of glucose into the blood and therefore maintaining a fairly constant glucose level in your blood and avoiding a spike in glucose. Fruits are always filling in nature because of their high water content and high fiber content. Consumption of fruits always decrease the level of comorbidities like obesity, heart diseases and stroke. And fruits are always a better alternative compared to sweet candies or other sweets in fulfilling your sweet tooth rather than you hogging on some other sweet stuff which are less in nutrition value. The most important thing is that even though you want to consume low GI food, always consume in lower quantities and always replace your diet with easily digestible vegetables, barley and rye, which will help you even better. Thank you.